Good afternoon. Welcome everyone to our webinar today on updating everyone around the SNAP and where we are. We're so excited to share critical information with all of our guests today. Thank you for joining us. As you come in, and we're going to get started in just a moment, but we invite everyone to put in the chat your name and what organization you're representing so we know who's in the room. We know this is webinar style, but we still want to know who's on live with us this afternoon. And so we thank you. Again, I am Reverend Najuma Smith, Assistant Director for the Center for Religion and Civic Culture, the Murray Center, and really excited about today's conversation. So as you come on in, please put in your name in the chat and what organization you're representing. We also have a Q&A feature. So at the bottom of your screen, you'll see that you can hit Q&A and then you can place your questions there. Throughout today's dialogue, we have someone from our team, Megan from our team, who's going to be pulling questions and sending them to me. So bear with us, but we will get to as many questions as we can. We have an exciting conversation in store, and we're looking forward to hopefully getting out critical information to all of you at this very critical time. Before we go any further, I'd like to bring on our director, Richard Flory, who wants to just share a word of welcome as well. Richard?
Thank you, Najuma. Good afternoon, everyone, and welcome to this session. In addition to our research on religion and society, the Center for Religion and Civic Culture is committed to supporting and resourcing faith and community leaders as they serve their communities. Our program on economic empowerment, which this session is a part of, which for us also includes individuals and organizations and the larger community, is one of several programs that we offer. The currently unsettled nature of our social and political environment calls for factual and timely information for both leaders and for their communities they serve. I hope this session will serve to provide not only answers to any questions you may have, but also provide you with important information so that you can better serve your community. Thanks for coming. I look forward to this conversation.
Wonderful. Thank you, Dr. Flory. Glad to have you joining us today. So let's tell you a little bit about who will be presenting today. Rosa Santana works with the Department of Social Services, and then she has with her members of her team that will be helping out with questions. And so we were so fortunate through Keisha Thornton to be connected with Miss Rosa, who so far has already given us a plethora of information. But today is about hearing how do we navigate going forward. It's about getting the information out, but about also navigating going forward. We know that there's been some recent updates to SNAP benefits and other areas like Medi-Cal and housing. And so a lot of that information you're going to get today, as much as we can. But know that this is not the last conversation, but one of a few. One of the things that we're committed to when we think about economic empowerment is not just banking or how to put money in your pockets, but also how do we ensure that everyone has information and access to information so that way you're thriving and living well. And we want to certainly empower our faith leaders, which is most of the community that we work with, so you can also share information with your constituents. And so take great notes today, ask as many questions as you can and need to, and whatever we don't get to today, we'll ensure that we'll get back and answer to you at some point in the future. But this is one of many conversations we're going to have going into 2026 around economic empowerment. So stay tuned. Make sure to subscribe to our newsletter. Follow us on Instagram as well as our YouTube page and our Facebook page so you get all the updates on what's going on and what we'll be sharing. So now let's introduce our presenter for today, our facilitator, Miss Rosa Santana, and she'll introduce her team. Rosa?
Good afternoon, everyone, and thank you for this opportunity. I'm really excited in being here, getting this opportunity to meet with all of you. I'm going to introduce my esteemed LA County DPSS colleagues, Diego, Ulysses, I see Anik here, and Liana. Liana will be helping me by sharing some helpful web links that you'll see in the chat as I go along with my PowerPoint presentation. And we do that to facilitate the opportunity, if you want, to bookmark some of these web pages so that later you can go back and reference them. And I'm going to be sharing after this presentation several more resources, community resources, and web links, because we all know that right now is a challenge for many families who are trying to make ends meet, hardworking families trying to make ends meet, and gaining access to healthy foods. So I've got a list that I keep updating and compiling that I'm going to share with you all later today so that it could be shared among your network. And again, I'm very honored to be here with you all. I'm going to start off this presentation with a saying that I really have believed in, and I believe in this saying. And I think it's more important than ever to do this, to stand firm on this. And the saying is, if you want to go fast, go alone. But if you want to go far, go together. And at DPSS, we aim to go together. We aim to be here by your side, hear from all of you, work with you, learn and explore how we can also support your efforts out in the community. And again, the fact that I've got several DPSS colleagues here with me also shows that we are at DPSS willing to step up and help one another. So I'm going to share my PowerPoint presentation here, and we could start with the actual formal presentation. Good afternoon, everyone. I am once again Rosa Santana with Los Angeles County Department of Public Social Services. And on behalf of several of my colleagues here, well, on behalf of the over 14,000 DPSS colleagues and the several that are with me here today, again, we want to thank you for all your hard work that you're doing out in the community. And we are very grateful for this opportunity to share important information among all of you. So I'm going to really today highlight and focus on two of our larger programs here at DPSS. But I'm going to give kind of an overview of my department first. So DPSS offers relief to families who lack a social safety net. At DPSS, we administer federal, state, and county-funded programs for people in need of financial assistance, nutrition benefits, healthcare coverage, housing assistance, and job training and placement assistance. And our mission is to enrich lives through effective and caring service. So DPSS is also the nation's largest social services agency. We provide assistance to 1 out of every 3 county residents, and we provide those services in over 240 different languages. So if you come across someone who perceives that they may not speak English fluently and they're hesitant in connecting with our department, please encourage them to connect with us. Again, we have a means to provide services in over 240 different languages. So the first program that I'm going to highlight is CalFresh. I think this is one of the programs that most people out in the community generally associate my county department with. So CalFresh is known federally as SNAP, and it is this country's most effective anti-poverty program. And it's one of the reasons why I was invited to come and share information with all of you to highlight some updates regarding the CalFresh program. So one thing that I really want to start off with is to, again, highlight and underscore an important update. Due to the federal shutdown, the ongoing federal shutdown, CalFresh benefits have been paused since November 1st. We encourage all of you to continue visiting the DPSS website at dpss.lacounty.gov or benefitscal.com or cdss.ca.gov for updates about the developments of this ongoing situation with the federal shutdown and how it's been impacting CalFresh benefits. And one thing that I really want to underscore with the community, with all of you, is that even though benefits have been paused, we are still encouraging people to apply for CalFresh. So even though the CalFresh November benefits have been paused, that does not mean that a person's CalFresh benefits have been terminated. It doesn't mean that we're not here to continue sussing out eligibility for the program. On the contrary, I'm doing these presentations as a second one today because we want to get the word out. If you know of someone who is experiencing food insecurity, we want and need your help in having those individuals connect with us so that we can begin the eligibility review process and make sure that they are connected to CalFresh if they need that assistance. So a little bit about CalFresh. CalFresh, again, is this country's most effective anti-poverty program. It helps eligible families gain access to nourishment and healthy foods. Participants receive their monthly CalFresh benefits on what's called an electronic benefits transfer card or an EBT card. And with that EBT card, an individual can make their purchases online and then go to their grocery store to pick up their items, or they can take their card in person when they're making their purchases at a store in person. And one thing that I also want to highlight is that many farmers markets throughout Los Angeles County actually do accept the EBT card. And not only that, but some of them are participating in the market match program where they match EBT dollars spent on site. It varies as to the amount that they'll match. It varies per farmer's market. But for some families that want to stretch their dollars, this is an option to buy locally produced items, locally grown items, fresh produce, fresh fruit, whatnot, and then have their dollars, EBT dollars, matched on site. So we're going to share information about how to locate a participating farmers market in your neighborhood, in your local area. People can also apply for CalFresh by calling us at 866-613-3777 or applying online at benefitscal.com. You can also hover a smartphone over that QR code that's on my slide and begin the process to apply for CalFresh. I encourage individuals to connect with us by phone and applying online because those are the quickest ways to start the process of connecting an individual with CalFresh. However, people still have the option. You can go to the DPSS website. We're going to be sharing those website links where you can download a CalFresh application in various languages, fill it out by hand, and you can fax a completed application. You could also mail in a completed application to DPSS, and you can also come by a DPSS office and drop off your CalFresh application. So there are various ways to connect a person with us. And again, we just really ask for your help. If you hear or see of anyone who is experiencing food insecurity, which is basically an individual not knowing when or where their next meal will come from. If you're seeing that happening, please, again, have them connect with DPSS. A couple of other things that I wanted to mention. individuals who are 60 and over and are disabled and are not getting any income from any kind of employment, and these individuals need access to healthy food, can complete what's called a simplified CalFresh application. The simplified CalFresh application is also on the DPSS website, and the application is available in various languages, including Spanish, English, Armenian, Chinese, and Vietnamese. The other announcement that I have is that the state of California has been mailing households, CalFresh households, their new EBT chip tap card so that people can just tap their card whenever they make purchases, so that people don't have to take their EBT card and swipe it or insert it in a machine to make their purchases. This new EBT chip tap card has even enhanced security features. And we are, again, just reminding people that if you have received your new EBT chip tap card, activate it as quickly as possible. So the old EBT card, that will only continue working for 180 days once you receive your new chip tap card. So once you get your new chip tap card, activate it. And we also encourage people to download a free mobile app called EBT Edge. The EBT Edge mobile app is a way for individuals to monitor their activity on their CalFresh their EBT card. You could spot whether there's unauthorized purchases that were made on your EBT card with the EBT Edge mobile app. You can freeze and unfreeze your card. You could just, again, have that extra measure of peace of mind and those enhanced security features of just monitoring activity on your card. Now, we also have to make people aware that the legitimate EBT Edge mobile app will not ask you for any sort of payment. It's a free app. You can download it from the Android and Apple app stores, and it's a free app. Unfortunately, there's also a very similar looking EBT Edge app. It looks very similar to the legitimate app, but the one that is not legitimate is asking people to pay $4.99 a month. We're not asking anyone to make any sort of purchase or $60 lifetime purchase to download the EBT Edge mobile app. The legitimate mobile Edge app is free. And the one that is a scam is the one that's asking for payment, asking people to input their credit card information. So if you see that, or someone comes to you and asks you why the EBT Edge mobile app is asking for information on payment, please encourage those individuals to disregard that, delete that app, and to download the legitimate EBT Edge mobile app. Okay. If anyone has noticed their benefits may have been compromised, please have them call the California EBT Customer Service Helpline at 877-328-9677 to file a claim within 10 calendar days for the loss of their CalFresh benefits. They're also going to need to contact us and also file a police report. And again, I want to underscore that all this information that I'm sharing, I'm going to be sharing with the hosts of today's webinar, so you can have this information handy. So I'm going to talk about some of the changes and updates that are going to be happening to the CalFresh program. Now, with the passage of HR 1, there are going to be changes to CalFresh. And these changes will occur at different times. But one of these changes is this requirement that CalFresh recipients will need to work to keep their CalFresh benefits. So with the implementation of this change, CalFresh participants between the ages of 18 and 64, these individuals would need to be able to work and not be a parent or a guardian of an independent child. These individuals will receive CalFresh for a maximum of 3 full months in a 36-month period, unless they work. They show proof that they are working and are doing training 80 hours per month. So again, this is a new work requirement. There are some exceptions, and we're going to put the website link, the DPSS website link, for more information about this new requirement, this work requirement, and the listing of some of the exemptions. In addition, there's another change that will be happening, in which many lawfully present immigrants will no longer qualify for CalFresh. And we're still waiting to get guidance on this point. But so some green card holders, asylees, refugees, they may no longer qualify for CalFresh benefits. And beginning this past Saturday, November 1st, there were changes in who will receive what's called the State Utility Assistance Subsidy, the SUYAs. With this change, some households may receive a reduced CalFresh benefit. And in addition, a smaller percentage of CalFresh households may possibly lose their CalFresh eligibility. So with this change, CalFresh households who have a person who's 60 or older, or a family member or household member who is disabled, and this household is not paying for heating and cooling expenses apart from their housing expenses, may qualify, may continue getting the state utility assistance subsidies. If there's an item about this that's changed, in other words, at one point you were getting this subsidy and you had an individual in your household, 60 and older, or individual, a family member was living with you who had a disability, but that's changed. We need you to please call us and update us. Conversely, like if there's someone new in your family who is 60 and over, a new family member that's now with you who may be disabled, and you're paying for, you're paying for the cooling, heating, apart from your monthly rent, you let us know of that. What's most important with all of these changes is please keep in touch with DPSS and send information, updates, any kinds of changes in your household, any kind of changes in your address, income. Please keep in close connection with DPSS. That's really, really important. We want you to continue. We want people to continue uninterrupted benefits. The federal shutdown is happening, and obviously that has interrupted benefits. But by and large, when that's lifted, we want people who need assistance and are experiencing food insecurity to be connected to CalFresh. And with that, we need your help to remind people to, again, if there's any kind of changes in their household makeup and their address and their income, that they connect with us and update us. Okay. I'm gonna call on my colleagues too. Diego, Ulysses, is there anything else you would like to add about this?
Rosa, you've given us, this is Najuma good again. Thank you, Rosa. This has been amazing. Thank you for the clarity about what CalFresh is. Some people, didn't know what SNAP was until the government shut down, until all this happened. So thank you for upfront really explaining what CalFresh does give people access to and what it doesn't and how it works. And thank you for sharing that people should continue, if they're experiencing food insecurity, still continue to
Yeah.
apply and submit their application, because when it lifts, they're already in the system. I do have a clarifying question, because what I'm hearing is, even if there are reasons where you may, the reason you're saying for people to stay in touch is that by keeping in touch and updating their status or their living situation or arrangement, even if one thing may disqualify, another status change may then qualify them. Is that what I'm understanding, Rose?
Diego?
Yes.
And it sounds like that's what, so I don't know. I'm just, because I
Yes, I'm
understand,
here.
because I guess my logic is, if I'm being canceled, but you're saying continue to keep updated and
Yeah.
continue to communicate, then maybe if my status changes, another change might then requalify or allow my family to be qualified to maintain their benefits.
Right. So I can take that
Thank
question,
you, Diego.
Rosa.
Okay.
So yes, for example, one of the populations that we have been trying to target for quite some time now is the student population.
Mm-hmm.
Um, there had been some dramatic changes to the student eligibility
Mm-hmm.
due to federal and state policy that rolled out back in 2022. So to give you an example, to answer your question, is a student may qualify only if they meet one type of exemption, right? Otherwise, students normally don't qualify for CalFresh. So if the student falls off from an exemption, maybe they're not meeting that exemption that they originally reported. Um, if they report their status, and then keep contact with the county, they may meet a different one. Doesn't mean that just because that exemption went away and they're not meeting it, doesn't mean they may not, doesn't mean they won't meet another one. So it's always important to understand that our clients, our participants who are receiving CalFresh, understand the responsibilities to avoid discontinuance and also ask questions so that we can inform them on how they can qualify. Other populations may include SSI, SSP recipients. Many of them before didn't know that they could qualify for CalFresh now. And that's another population that we are trying to target, our elderly, our disabled, and whatnot. So yes, to answer your question, it's always a good idea to stay informed, visit our website, call our call center, and we can provide the best assistance that we can. Thank you.
Yeah, thank you, Diego. And the other thing too is that once we're assured that we have CalFresh customers' updated contact information, then we're assured that that individual is going to get, live updates and information from us. So again, we want people to continue connecting with us, providing us with updates. If they have a new address, phone number, cell phone number, email address, to notify us by calling our customer service center. But I actually even wanted to touch on Medi-Cal, but pretty much I wanted to tap Ulysses or Diego to talk a little bit more about CalFresh. But if we're ready, we can move on to another program that I think most people associate my department with. And I also want to be mindful if there are any questions. I saw a lot of chats, but I don't think there are any questions yet. But we can move on to Medi-Cal. So my department also administers um, uh, healthcare programs, and this is our largest program, and another program that I think most people associate BPSS with. It's CalFresh and Medi-Cal. Medi-Cal provides free or low-cost comprehensive coverage to eligible individuals. And I wanted, because I did a presentation this morning, and the topic of Medicare came up. So Medicare is the federal government's healthcare program for individuals, I believe, 65 and older. Medi-Cal is for individuals who are low income and need access to medical care. Anyone can apply. Again, you have to meet particular requirements to receive Medi-Cal benefits. Applications are accepted year-round, and there is no enrollment period. Oh, and I got an important update as well about Medi-Cal. And once again, as we all know, the federal government shutdown is touching many aspects of our everyday lives. So due to the ongoing federal government shutdown, Medi-Cal is funded through December 31st, 2025. Again, we encourage all of you, please visit the DPSS website, dpss.lacounty.gov, for updates and information about developments. You could also visit benefitscal.com or chhs.ca.gov for ongoing Medi-Cal updates. Medi-Cal falls under two categories. One is Magi Medi-Cal, which uses IRS tax rules to gauge whether a person qualifies for Medi-Cal. Magi is probably one of the more common forms of, or it's more commonly used. It was created as a result of Obamacare. And Magi is, generally speaking, more for pregnant women, adults under 65, and children under the age of 19. Non-Magi Medi-Cal is when a person needs to meet specific criteria. And generally, that criteria is you're 65 years of age or older, in long-term care, or disabled or on SSI. And it does not consider income or assets in the same way as Magi Medi-Cal. So I'm going to give a couple of updates about Medi-Cal that have been really important for us to announce and make people aware. So since January 1st, 2024, California was actually the first state in the nation that offered full scope Medi-Cal to all residents who qualified regardless of immigration status. And also effective January 1st, many assets and properties were not being considered in determining Medi-Cal eligibility. However, beginning January 1st, 2026, these two policies are going to change, which is really important to raise awareness of this, because if you do know someone who is working, trying to make ends meet, and through their employment, they don't have any health care options, and they need access to medical care, we encourage you to please have those individuals, have those families connect with us, regardless of immigration status. So effective January 1st, 2026, the following Medi-Cal changes will take place. Assets will be counted for Medi-Cal eligibility. This will impact the non-Magi beneficiaries. The asset limit for a one-person household will be $130,000. The limit increases by $65,000 for every additional person in the Medi-Cal household. Also, individuals who apply for Medi-Cal and who have what the federal government is determining as unsatisfactory immigration status, those individuals beginning January 1st, 2026, will no longer be eligible for full scope Medi-Cal. They will only receive restricted scope benefits. And restricted Medi-Cal only covers emergency and newborn care. So these are some of the services that an individual gets through full scope Medi-Cal. So again, beginning January 1st, 2026, individuals who have unsatisfactory immigration status will no longer be eligible for full scope Medi-Cal, but rather they will only be eligible for restricted scope Medi-Cal benefits. And with full scope Medi-Cal, individuals can receive hospitalization, dental services, pediatric services, laboratory services. So this change in this policy, again, will take effect on January 1st, 2026. Okay. And if there's an individual right now who has full scope Medi-Cal, and they have with what the federal government determines as unsatisfactory immigration status, these individuals, they currently have full scope Medi-Cal, and they renew their full scope Medi-Cal benefits on time. They're going to continue receiving their full scope Medi-Cal with the exception of dental benefits. This population, the unsatisfactory immigration status population, ages 19 and over, I believe, they will lose their dental benefits beginning July 1st, 2026. So again, I want to underscore it's very important that people complete and submit to DPSS their renewal documents quickly. And this is for all Medi-Cal recipients, including those with what's determined as unsatisfactory immigration status. We want people to continue having their benefits, to remain healthy, and again, just keeping in touch with DPSS is very important. Oh, and one thing I want to note is this week, my colleagues in Medi-Cal Program and Policy have been hosting free webinars with Medi-Cal policy updates. I've attended like 2 or 3 of those webinars. Every time I attend in English or Spanish, I learn something new. This is an opportunity for the public to hear directly from DPSS's Medi-Cal policy experts, ask questions of them, and get a broader, deeper dive into some of these Medi-Cal policy changes. So I'm just kind of highlighting important policy updates that'll impact Medi-Cal beneficiaries, but in those webinars, you get an opportunity to, again, go into Medi-Cal on a deeper level and ask more questions pertaining to even some additional future changes that may take effect in 2027. My colleagues touch on some of the policy changes that are coming, that are expected to take effect in 2027 in regards to Medi-Cal. So if you haven't attended one of these webinars, I highly encourage you to do so. They're free. They're about an hour long, and you can register at dpss.lacounty.gov. These webinars are being offered in various different languages as well.
Rosa, thank you again. This has been a plethora of information, and we want to just kind of take a moment to ask clarifying questions for those that are taking notes and listening, and also for those that will watch the replay of this. We did have a couple of questions come in.
Okay.
And so for those that have the MAGI, the MAGI medical, the full scope, I'm gonna say full scope Medi-Cal, there is a population that will lose those benefits January 1. Is it safe to say that between now and January 1, that they can take full advantage of their full scope medical coverage now?
Yeah,
Not dental, we know they have until July. So
right.
so I just want to make sure that people are clear that if they currently, or if you have a population of people that you serve, especially for our faith leaders, and they have full scope now, and they might be in threat of losing that come January 1, that they can take full advantage of that full scope now, correct?
So I'm glad you asked that question, so
Okay,
I can clarify that.
thank
So
you.
if there's an individual with what's called as, and it's a federal term, the unsatisfactory immigration status, that's the term. And right now they have access to full scope Medi-Cal. They're going to continue with their full scope Medi-Cal in 2026. The only difference is that beginning July 1st, 2026, they won't have access to dental services anymore, dental benefits. Aside from that, they'll continue having their full scope Medi-Cal.
Mhm.
An
But the
individual,
restricted scope will begin January
yeah.
1.
So you have an individual with this unsatisfactory immigration status who applies for Medi-Cal January 1st, 2026 or thereafter. They will only be eligible for restricted Medi-Cal, which is just emergency services.
Okay.
You're not going to get this kind of service, that comes from the full scope Medi-Cal.
Okay. And so, and again, this is a clarifying question.
Yeah.
So, those who are currently here in California and are immigrants, and they have not there, and the designation that the government has given is unsatisfactory status, or they're not fully come through their immigration process, they still are eligible for medical benefits, even if it's restricted. Yes,
January 1st, on January 1st,
January 1st,
it'll be
restricted.
restricted.
But they will have it, which will
But
include emergencies and new
newborn
births,
care, yeah.
newborn care.
But
Okay.
if this individual with the unsatisfactory immigration status applies right now for Medi-Cal, they're eligible for the full scope Medi-Cal,
For a
and
full scope.
they'll keep that full scope Medi-Cal. So anyone who needs access to Medi-Cal and they fulfill the other eligibility requirements, the current eligibility requirements, um, and they apply regardless of immigration status up until December 31st, 2025, they will get the full scope Medi-Cal.
Okay, that's
It,
good. Thank you.
the change is going to begin on January 1st,
Okay,
2026.
thank you. Thank you for that clarifying. So there was report in the news, and I'm not sure if you or someone on your staff can answer this. There was a report on the news that that partial SNAP benefits for November would be released. Is that correct, number one? And is there any updates you can give us about that?
So for that,
Partial SNAP. And
yeah,
who's and the other part, the second part to that is who's the partial? How is partial being administered?
that I'm going to defer to my program and policy colleagues here. I also read those updates too. So,
Yeah, I can take it, Rosa. It's fine. So the only update that we have right now is that the state, along with the federal government, are working together to figure out what amount they're going to be able to release to the public as far as CalFresh throughout the state and other areas. And I say CalFresh because that's the formal name here in California, right? It's SNAP in other states. So there is an emergency fund that they're looking into in order to, as a measure to try and assist the public get CalFresh benefits. However, we do not have any updates other than that. They have not released any further information. All we know is that they are working quickly to make that happen. Thank you.
Thank you.
Thank you, Diego. Yeah, I want to clarify
Rosa, I'm
too.
sorry. I'm
Yeah,
sorry, Rosa. One
go
one
for it.
last question, because I just want to make sure
Go
for
for
people
it.
that are listening, taking
Yeah.
notes, I want to always ask the clarifying question. Because and thank you, Rosa and Diego and others. And I know you've mentioned a couple of times about notifications will go out. So just as a clarifying question, for the individuals that are currently on CalFresh, which is what we call it here in California, and we do know that people that are on in other states, I know Nevada, Florida, and so CalFresh and SNAP is same thing, just different name used. But for California, we say CalFresh. So if we say CalFresh, we're not excluding those of you that are out of state. So you talked about notification. How should people look for their notifications to come through regarding their CalFresh or SNAP and their Medi-Cal, as these changes are coming in very fast? And most people are unfortunately getting their news and updates, their updates from the news and social media. What is the official notification people should be looking for who are currently receiving the CalFresh SNAP benefits?
That's why I've been underscoring the need
Mhm.
to, again, make sure that a person, a CalFresh recipient or participant's home address is current with us, their cell phone number is current, um, their email address is current, because those are the ways that we're going to be connecting, and we've been notifying people. It's through the emails, through text messages, um, mailings. And it's very important, as my colleague Diego mentioned, there is, a mutual responsibility in this. We notify our customers, but we also need our customers to connect with us and make sure that we have their current contact information on file.
Mhm. So potentially a way that faith communities can help in this season is by encouraging our constituents, individuals in our community, in our churches, our houses of worship, because we know that not just churches are represented here today, that we're communicating to make sure that adequate mobile number or email address is provided so that when notifications come, people are getting directly to their email and text messaging. So we're not relying on what might be social media posts and or the news, which unfortunately sometimes they're incorrect. Would that be correct to say?
Yeah, and Diego, you have something else? I see your hand up.
Yeah, just wanted to add on to your response. So another way that we do communicate with the public is through our strong relationships with the community-based organizations and colleges. USC is one of them. We send out email blasts when there's a significant change in policy to those organizations that serve the public. And then we ask that they communicate that to the populations that they service, whether it be through mass email on their to the people they serve, or text. Now it's important also that our customers who are receiving any type of benefit, they enroll in text messaging. That's an option. And if they don't, they miss out on very important information. So that's also another, like Rosa said, underscore. You must enroll in the text messaging for you to get those live updates.
Thank you for that, Diego, for that
Thank you.
clarification. Thank you, Rosa. So I just want to go back because again, I'm asking clarifying questions. An organization can partner with DPSS and communicate information directly from DPSS to constituents, clients, customers, congregational members, et cetera, et cetera. Is that what I'm hearing?
Yes. So
Okay.
I'm part of the community engagement unit where I do
Yes.
this, right? I send information, I send emails. Diego works closely with our CalFresh application assisters. So we are partnering, we're working with our community-based organizations, faith-based organizations, because as I started out this presentation, we want to go far, but to go far, we need to to work together. We could go
Wow.
fast and you go alone, but it's a mutually beneficial opportunity to help one another in making sure that accurate, timely information is disseminated. And for that, we do need your support and help. One thing I wanted to say really quick, and I should have pointed this out. I did say that SNAP, CalFresh is known nationally as SNAP, but in California, we brand things a little, right? To have that California spin to it. So on a federal level, SNAP is known here as CalFresh. Again, on a national federal level, Medi-Cal is known as Medicaid.
Okay,
Okay,
thank you.
Diego.
And so I just want to say this to all of you that are watching and who will also watch the replay of this, all of our community members, faith-based leaders. Here's an opportunity. Don't miss the opportunity. And we'll make sure that you are part of Rosa's list. Our office will be working with her. So that way, when as the community engagement liaison, when information goes out, if you're part of her list, then you'll get that timely information, and then you can be a hub of information for your community, for your organization, or people that you work with or work with you. And so this is an opportunity for community partnership, where you can get the information, timely information, correct information, and then share. Because one of the tragedies that we see happening is misinformation, even disinformation, on social media and things of that nature. So I just want to say to all of you that are part of today's webinar and to also watch the replay of this, this is a direct opportunity for your organization to partner with Rosa's team to get firsthand, timely information, correct information, and then be a part of the message amplification. So
Yep.
thank you for that. Thank you for that clarification, Rosa. Thank you, Diego.
Yeah, I wanted to just a few more slides here that I wanted to touch on. I know that we're coming to the end, but I do want to touch on these items here. So along with Medi-Cal, we also administer the in-home supportive services, which is also known as IHSS. You have to be a California resident, 65 years or older, have a disability, and children can also actually, children with a disability may also be eligible for IHSS. And through IHSS, that just like its name alludes to, you remain in your home and you get assistance. So this is a really good opportunity to have someone still stay at home, but receive support from a family member, a trusted friend, or a caregiver, and that person can stay in their home, be in their surroundings, but yet get supportive services by someone who is trained and can support in any way. So to apply for IHSS, an individual can apply by phone by calling us at the numbers that are on the slide. And again, I'm going to be sharing all these resources with you all. They can apply by fax. The form is SOC 295. You can download that. You can download that from the DPSS webpage. You can also download the form, the SOC 295, fill it out by hand, and then mail in your application as well. And I've got the address to where you can mail your application. It's a really good service for older generations or even children with disabilities who, again, they thrive in their home environment, but they need a little bit of that support and help being at home. To apply for assistance, we really encourage people before they even connect with DPSS to make sure that they have all the information that they will be requested when we begin the eligibility review, the program eligibility review. So there's any kind of proof of identification, proof that they are living in Los Angeles County, verification of income and expenses, proof of address, any kind of pay stubs. Again, just to determine how many people are in a home. Um, we suss all of this out to determine program eligibility. And our eligibility workers are very determined and very committed to helping our customers. So the more information that an applicant can provide from the from the start, from the get-go of the eligibility review, then we can move that process along and ensure that there's a thorough review and overview of eligibility, potential eligibility. Individuals can also apply for public assistance in California through what's called benefitscal.com. It is a user-friendly, secure website that will collect information from customers. And benefitscal.com is the portal where Californians can get and manage their benefits online. It unites all 58 counties throughout the state on one system. Benefits Cal is available in several different languages, Chinese, English, Hmong, Japanese, Korean, among just a few. There's a really informative, helpful Benefits Cal YouTube channel with a lot of informative videos on how to start or establish a benefitscal.com account, how to upload your documents onto benefitscal.com. Also, benefitscal.com is mobile friendly, so there's no need to download an app. You could just, from the convenience of a smartphone, just apply at benefitscal.com to begin the process of obtaining public assistance. People can also contact us at the Customer Service Center. Our hours are Monday through Friday, 7:30 to 5:30 p.m. And again, I really want to highlight and encourage as many of you as possible, visit the DPSS website for updates and any kind of resources or information. We're going to be posting it there, dpss.lacounty.gov. And please, if you haven't already been following us on social media, we encourage you to do so. We have an incredibly robust presence on our social media platforms. We're on what's formerly known as Twitter. It's now known as X. We're on X, we're on Facebook, we're on Instagram, and I really want to give a shout out to our YouTube channel. On our YouTube channel, we have a series called What is DPSS? And you get an overview of our various programs that we administer. And the individuals highlighted in our What is DPSS videos are all my colleagues. So even though we are the nation's largest public social services agency, we are individuals who live in the communities that you are serving. We are individuals attending, your places of worship. We're part of the community. And those What is DPSS videos are intended to to kind of put a face to humanize our department. We're not just this big building. We are individuals who, like all of you, care about our neighbors, and we really are here to serve the public and help those in need. And my contact information is there. If you have any questions, you can contact me anytime. That's my direct phone line. That's my email address. And, I want to hear from you.
Mhm. Rosa, thank you. One thing that I shared is I know that up until maybe a week or two ago, nobody was thinking about DPSS or SNAP, and your team has been thrust to answer questions for the government that you may not have all the answers for. So I really appreciate the time, and I know you've been thrusted into having these conversations and to make some things clear. So I want to just honor that and just say thank you and thank you to your team. I do have a couple of final questions. There was a question, and you may not be able to answer this, but I do want to respect the question that was asked is, do we have any idea how long it would take to get back to normal? And that was one question, but also a question came through around, can the county provide a district level breakdown by zip code showing the neighborhoods most impacted? Is there some mapping that's available for those in the community, especially those that are doing activism work and policy work, that's showing neighborhoods that are most impacted.
So Diego, I'm gonna defer to you with a heat map.
Yeah. So the county does not collect program data at a zip code level breakdown. However, there is a public facing dashboard that is available to the public, including our partner organizations, that they can access to pull CalFresh program data. It's broken down by census data, how it's gridded across the state, and student data, among other type of data. I did put the link to that data dashboard in the Q&A so
Thank
that
you.
our partners here who are joining us can copy that link, explore the dashboard. It's really helpful. We use it here at a county level to do analytics and find areas of opportunity of how we can better service the public. So, and then to answer the other question, when are we gonna get back to normal? We don't know yet. We hope soon. However, we encourage everyone that you link the people that you serve and also yourself to our website, like Rosa
Yeah.
said, and ensure that our customers are receiving text messages, because as soon as we have news, you will have news.
Wonderful. Thank you, Diego.
You're welcome.
And I just want to say also to those that are on with us live and those that, of course, will watch the replay, I'll be working with Rosa. She does have an active list. This is one of the reasons why we also ask everyone to make sure to register, but also let us know what organization you represent today. So if you haven't done that in the chat, please do so. I'll be working with Rosa as her team to help her update the list that she does have and even expand it. So, so that way, when she gets information as the community liaison, community engagement liaison, you're on her list and can get accurate, up to date, in the moment, timely information. This is how we work together to empower the community with right information. And so help us do that. We're here to help you. Help us do that. And to all of our leaders on, thank you for joining us. Rosa, did you have anything final you want to share?
Yeah, I don't know if you see the website. Can you see? I screen shared. Okay, so this is the main DPSS website, and on the upper right-hand corner when it says translations, you click on that, and there's a drop-down menu for having the website translated in various different languages. So again, if there's anyone who is a little nervous about approaching us, they perceive that they may not be fluent in English, please encourage them to come to the DPSS website, um, select one of these different languages from the menu, and connect with us, because we honor, we value, we embrace the diversity in Los Angeles County. We're proud of it, and anything that we could do to support our communities, we're going to step up and do. And again, this is the link to benefits to CalFresh. I mean, you would click here in that red button, apply for benefits. You click there, and it takes you automatically to benefitscal.com. And this is where you would apply for benefits. And again, this is also where there are updates. The state is notifying the public on developments and updates.
Okay. I do have one final question from somebody. They said, who do I contact if a person reports his or her Medi-Cal has been cut off because of the shutdown, and now they are being asked to pay their IHSS worker directly in order to keep their worker?
Okay, so with that one, that sounds more case specific. I would ask if that individual could just email me.
Okay.
So they can email me, and what I would need is a case number and a name, and what I could take it from there. They can also call the IHSS helpline. Let me call up the IHSS. There's also a chat feature on the IHSS webpage where you can actually live ask a question like that and get some feedback and help and assistance from our live chat. But you can also call the IHSS helpline, or you can also call me, email me.
All right. Thank you, Rosa. Any final thoughts, Diego or Ulysses? We appreciate you being on, answering questions in the chat, in the question Q&A. Anything that you believe individuals need to know today?
Yeah, a couple things. Thank you for that. So we're partnered, CalFresh program, my section is partnered with over 500 organizations across LA County.
Wow.
Some of these organizations even have operations outside of LA County, perhaps Northern County, Middle County, but we still help them out. We encourage you to know that we do try to assist in any way, shape, or form. If they want to make the connection, anyone here wants to make a connection with my team, email please Rosa Santana. She was displaying her contact information on the screen. We do support in many different ways, but one of the main ones we do support here in CalFresh program is we prepare our organizations to take CalFresh applications if that's a function that they voluntarily want to take part of. And we have a virtual training, so you don't have to go leave your office or your place of work. And every second and Wednesday of the month, we invite you to partake. Even if you don't want to be an application assister at your organization, that you observe, because we do provide some very insightful information, many of which Rosa stated, but it's very focused on CalFresh program. And with that said, that's it for me. Thank you so much.
Thank you. That's really good, Diego, because we do have a lot of community-based organizations and faith communities represented today, and those who watch a replay. So again, to those of you that are on who work with us, we're always talking about being hubs of information. And, this is another way that, especially for those of you that have capacity, where you can be an intermediary and assist with these kinds of applications for individuals in your community and your organization, congregation, house of worship. So thank you for that, Diego. Ulysses, anything for us?
Honestly, I don't have anything to add. I think my colleagues have covered all the information that we wanted to share with you. Or just I can add about, so I manage outreach services for my department, for our department, DPSS. And my staff can come out to your events if you're hosting a resource event, wellness, health fair. We can come out and set up. You can offer a space for us. We can host a resource table where we can provide on-site enrollment services and also provide information about all the programs administered by our department. I'll post our email account in the chat. And if you're interested in having our services at your event, if you're planning an event, you can send me an email there and I'd be happy to get back to you so that we can coordinate our participation.
Thank you. And again, I'm going to say thank you for that, Ulysses. Again, to all of our CBOs and faith leaders out there. Some of you are having your holiday giveaways and holiday givebacks. This may be a great opportunity to have Ulysses and his team come out and provide for them a space where they can work with the community directly. This is what it's about. It's about getting direct information, correct information, and timely information, because that's what's going to really help the community the most. And so thank you, Rosa. Thank you, Diego. Thank you, Ulysses. Thank you to our team here at CRCC and USC. And thank you to each of you for joining us today. Please let somebody know the Zoom is available. As soon as we're done, the recording will be available so that you'll be able to click the link and rewatch it. And it will be up on our YouTube and Facebook page. And so feel free to review it, share it, preview it with your community or your staff, and get all the necessary information. And then we'll be working with Rosa to make sure, for those of you that gave us your information, your organization, we'll make sure that your content is included on her list so you all can get the timely updates because things are moving fast. But I think you said, Rosa, if we go together, we'll go farther.
Yes.
Yeah. All right. Thank you, everyone. Have an amazing day. And we will share with you soon upcoming conversations similar to this one. Thank you and
Thank
have a
you.
great
This is
day.
great. Thank
Thank
you.
you.